Hi everyone, Dr. Emmy from Pain Free and Fit. Today a great video for those of you with cervical degenerative disc disease and herniated discs in the lower neck. We're going to be talking about a great technique to release and relax the muscle tension in your neck that's aggravating your pain. Hope you enjoy. So with a lot of my patients as well as online clients with cervical degenerative disc disease, herniated discs in the lower neck, and bulging discs don't realize is that much of their neck pain may not be due to the actual disc or the facet joint that's being irritated, but rather the muscular tension that develops. Many people with disc problems in the neck have excessive muscle tension in the paraspinal muscles that run up and down their neck, particularly the trapezius, which is the largest, most superficial muscle that runs from our shoulder blade into our neck. Tension here due to poor posture, stress, reflexive tension due to herniated discs many times causes pain because trigger points or tight nodules that develop in these muscles irritate nerves and cause pain. The tight muscles can also clamp down on the spine, further irritating the disc herniation. So today we're going to be talking about how to release this muscle tension, and you'll be able to decide how much of your pain may actually be due to muscles, and if so, you'll have a great technique to help reduce your pain. Begin with your shoulder blade position. Most people with degenerative discs and herniated discs in the neck don't realize that the shoulder blade position plays a large role in the tension in the neck. You can look at this by two different ways. Number one, by changing your shoulder blade posture. Let's start with rounding versus retraction. Most people have a tendency to round their shoulders forward. The front of the shoulder should be flat. You could either close your eyes and feel what your neck pain feels like, and then slowly pull your shoulder blades back and forward and see if a position eases the tension and makes your neck feel better. If it does, that's the tension you need to be holding your shoulder blades in more often. Likewise, if you have a tipped shoulder blade where the shoulder has a tendency to have the top of the shoulder blade move forward and the bottom of the shoulder blade move away from your rib cage, you can tense the bottom of your shoulder blade forward towards your rib cage. Now when you do that, don't move the whole mid-back backwards. You're just trying to localize the motion from the shoulder blade into the ribs. And when you do that, again, if you close your eyes and focus on your neck discomfort, you may notice that at a certain point, it's going to ease that discomfort. And then you know you need to correct that tipped scapula postural problem that you have. Another common issue is elevated or shrugged shoulder blades. Many times due to tension and posture, we have a tendency to hold our shoulder blades more upwards, increasing that muscular tension. So here, if you tense your shoulder blades slightly downwards towards your hips, you may notice again a relief of that neck pain. Now besides pain, you can actually use one or two hands on your upper trapezius muscles between your shoulder and your neck. And as you use these corrections of shoulder blades unrounding, tipping, and downward tension, you may notice that the tension changes. So sometimes it's not even the pain that's changing, but if you notice a particular position under your finger, that trapezius muscle has relaxed or is softened, that's the position you want to practice. Plug this into your routine at home. Practice putting yourself into that shoulder blade position. Also look at your neck posture. Most people have a tendency to have their head come slightly forward with neck problems such as degenerative discs, and by pulling the face slightly backwards towards the back of the head without elevating or depressing the chin, again, you may notice a change either in pain or muscle tension. Correcting head tilting, such as right to left, can also correct such a dysfunction. And if you have a tendency to always work off to one side, such as looking to the left, tensing your head to the other side and finding a neutral position that best relieves tension in your neck or palpable, feelable tension in those muscles can go a long way to decreasing the pain and over a long period of time, decreasing the stress that's applied to your lower discs. If you've enjoyed this video on muscle tension and disc pain, feel free to subscribe to our channel. We've got a lot of great videos out there to help you. Questions or comments, as always, write in. I'll do my best to answer. And remember, if you're looking for a great routine to learn how to strengthen your neck, how to rehab it, how to get it back active again without hurting, check out our neck healing exercise program available at painfreeandfit.com. I hope this video on cervical degenerative and herniated discs with muscle tension helps you with your chronic neck pain.